Welcome to the program titled Bariatric Sensitivity. There's so much we still need to learn about sensitivity training, but what we do know is that it's not as simple as mandating be sensitive. The purpose of this presentation is to really look at challenges in weight regulation, understanding the meaning of that word weight bias, and then talking about some ways that we can overcome insensitivities in caring for larger, heavier patients. Weight regulation is a widely misunderstood phenomenon. The National Institutes of Health, NIH, explains that obesity is a multifactorial condition. But regardless of the biochemical factors associated with weight gain, we do know that weight gain occurs when there are more calories consumed than in those expended. So let's talk a little bit about weight bias. Let me share some studies with you about the cultural climate pertaining to obesity and perception of obesity. Children as young as 6 years old were shown cards with pictures of other children. The children were asked to identify which child they would prefer not to have as a friend. The cards included pictures of a child in a wheelchair, one who had lost his hair to cancer treatment, an obese child, and others. The children in the study selected the child in the wheelchair over the obese child to be their friend. The children in the study described the silhouettes of obese children as lazy, ugly. This is regardless of the child's race, ethnic background, or socioeconomic study. A study that examined the feelings of college-age students regarding the obese individual was not much different. College-age students rated obese friends as warm and friendly, but also rated them as less active, less disciplined, and less hardworking. Healthcare professionals also show a significant pro-thin, anti-fat bias. Additionally, obese patients feel misunderstood and mistreated by medical and non-medical personnel involved in treatment of their obesity. Rather than acknowledge the limited effectiveness of current weight loss treatments, patients are also often blamed for noncompliance or for lack of self-control, motivation, or discipline in their health care. So is weight bias real among physicians? A number of research studies suggest that obese patients have been viewed by some physicians as lazy, lacking willpower. One study concluded that some physicians associated obesity with noncompliance, poor hygiene, and hostility. How about nurses? Is weight bias real among nurses? Hope and others studied nurses' beliefs about obesity and weight-related interventions in the primary care setting. A third of respondents to the study indicated they would prefer not to care for the obese individual at all. Nearly half of respondents felt uncomfortable in caring for the patient of size. And among the 586 nurses in the study, the majority considered non-compliance as the main reason for the patient's inability to lose weight. Let me share information about the terms empathy and apathy. Empathy toward another person is common in healthcare and among healthcare workers. It's the nature of healthcare workers. Empathy is defined as the understanding of another's situation. We often feel deep empathy toward certain categories of patients, such as the patient who's been disfigured either with facial deformity or limb loss, or a patient who has cancer, perhaps with hair loss, which is evident to all of us. We generally make every effort to make things better for this category of patients because we have empathy toward this patient population. Apathy, on the other hand, is defined as lack of emotion or feeling toward an individual or category of individual. For example, how do you feel about the individuals in the group on the screen? If you're like many nurses, doctors, and other healthcare professionals, you might feel sorry for the individual, but it's a different kind of emotion. When we look at the individuals on the screen, do we see them as individuals living with the chronic disease of obesity? Do we view them as vulnerable or part of an underserved category of patient with a largely misunderstood condition? And then finally, would we go out of our way to accommodate their needs? This is the heart of weight bias when we talk about this. So let's go back to the question, is weight bias real among nurses? Kaminsky tells us that a relationship exists between presence of proper tools and resources and the degree of empathy in a particular clinical area. This makes sense. Nurses and all healthcare workers want to do the right thing. We want to provide the patient with the best possible outcome and patient care experience. If we don't have the tools and resources necessary for the task, we feel frustration. Over time, this leads to a hesitation to embrace the care of the more complex patient or the obese patient or resident. The challenge is to recognize the safe patient handling or the technology needs in your respective clinical area, and then seek proper technology and training in that area. I want to conclude this brief video by sharing a couple of studies that were recently published. The studies can be found on the Vitalgo website, and a link is attached on the corresponding brief, which you'll see in this website. The studies suggest that appropriate technology can be instrumental in reducing patients' length of stay and ensuring safe early mobility. This is especially important in addressing complex patients such as the obese patient population or the obese individual, especially within that context of patient satisfaction and the patient care experience, and then worker satisfaction in addressing the needs of a very complex patient. The most important message is that healthcare workers will always hesitate to embrace the care of the larger, heavier patient when there is a fear of injuring oneself or the patient. Proper technology is the key to creating a sensitive environment for the patient of size. The Vitalgo Total Lift bariatric bed is one such technology. So I want to thank you. And to learn more about bariatric sensitivity, I encourage you to review the attached brief or the brief on this Vitalgo website titled Getting to a Sensitive Environment of Care. Thank you.